Hi, I'm Dr. Terry Pinson, Medical Director of the North Mississippi Medical Center Bariatric Program. I'm here to present our Bariatric Educational Seminar. Our goals will be to define bariatric surgery. We'll define obesity. We'll talk about the indications for operative intervention or surgical therapy. We'll describe the techniques that we use: laparoscopic Roux-en-Y gastric bypass, laparoscopic adjustable gastric band, and laparoscopic vertical sleeve gastrectomy. Now, bariatric surgery. This is a field of medicine encompassing the study of obesity, causes, prevention, and therapy. What is obesity? It's a lifelong, progressive, life-threatening, genetically related disease process of excess fat storage, and along with that, multiple comorbidities or disease processes. So what is obesity? Obesity is a point where serious medical conditions occur as a direct result of that obesity. Obesity is defined as having a body mass index of greater than 30%. Morbid obesity is defined as having a body mass index of greater than 40. Now, body mass index, this is a height to weight ratio. The lowest mortality, the lowest chance of dying of those patients who are in ideal weight, who have a body mass index of less than 25. Those patients who have a body mass index of greater than 40 generally don't live as long as those patients who are in ideal weight because of the other conditions that develop from their morbid obesity. Morbid obesity is greater than 40 is approximately 100 pounds over ideal weight. Surgery is also an option for patients with a body mass index of less than 35, so please click on the link provided to find out your options for surgical treatment for obesity if you're in the 30 to 35 range body mass index. Now, body mass index, this is a World Health Organization classification. Ideal weight's a body mass index of 18 to 25. Overweight's 25 to 30, moderate obesity is 30 to 35, severe obesity is 35 to 40. Morbid obesity is greater than 40. Ideal weight, this is what you should weigh. For a female, if she's 5'6", she should weigh between 135 to 140 pounds. Males, if they're 5'10", for example, should weigh between 155 to 160 pounds. All the weight above this is called excess weight. Now, obesity is a huge problem. It affects all of us in some way or another. You have a family member that's battling obesity, you have a friend, coworker, someone that you are in constant contact is battling obesity. It affects all of us in some way. It turns out about 69% of adults aged 20 and over were overweight or obese between the years 2011 and 2012. About 48% of American children are obese. That's huge. The next generation is going to be battling this disease process in epidemic proportions. 6% of all healthcare expenditures are related to obesity, correlating to about $238 billion a year. Now, according to the Centers of Disease Control, the CDC, Mississippi, we're always one or two. It affects about 34.6% of our residents. That's huge. That affects all of us in some way or another. Now, obesity-related comorbidities, there can be economic issues, social issues, physical issues, medical and psychological issues. A few of the comorbidities, physical factors, there can be limited clothing choices, increased prices. If you have to go to a special store to buy clothes, generally they cost more. There can be furniture incapacity. If you get on an airplane, you have to ask for a belt extender. You may have to go to a certain restaurant and try to get in a booth and you can't fit. Many of our patients battle and complain about this. We have down the bottom tying shoelaces, and you ask, why do you have tying shoelaces? See, it goes back to this patient we had. She came in after a bariatric procedure and she was so excited. She came in and said, I can tie my shoes. I can tie my shoes. And I looked at her and I thought, oh man, something's happened. And she started laughing. She said, you don't get it, do you? I've never been able to bend over and tie my knot on the top of my shoe. Now I'm able to. Little things can be a big deal. Medical comorbidities. Our patients commonly present with diabetes, hypertension, hyperlipidemia, respiratory disease, including sleep apnea. It turns out about 80% of the patients who present for a bariatric procedure have elements of sleep apnea. Arthritis, depression, stress incontinence are all processes that are very common with patients who battle obesity. If a female is in the fertility phase of her life, there can be many menstrual irregularities or infertility. Morbid obesity is one of the most common causes of infertility in our region. Diabetes, the risk of developing diabetes is 2 times higher with just mild obesity, 5 times higher with moderate obesity, and 10 times higher with severe obesity. About 90% of type 2 diabetics are overweight. The great thing is there's about 80 to 95% improvement with bariatric surgery after significant weight loss. Hypertension. Obesity causes more than 30% of all hypertension. If you think about it, if you have a 10% weight gain, generally your blood pressure increases by about 6.5 millimeters of mercury. What if you're on the fence right there? You're borderline hypertension. All of a sudden, you jumped over in a full blood hypertension. By being 20% overweight, the risk of hypertension is 8-fold. Morbid obesity, 16 times higher. The great thing is there's about a 50 to 75% improvement after significant weight loss with bariatric surgery. Obesity-related cancers. Esophageal carcinoma. There are higher incidence of esophageal carcinoma, probably related to the higher incidence of gastroesophageal reflux disease in those patients who battle obesity. Colon carcinoma, we know there's a higher incidence, we don't understand the mechanism. Cervical, breast, prostate, ovarian, and uterine probably have to do with the changes in estrogen metabolism in the distal fatty tissues in the patients who suffer from morbid obesity.